Good afternoon, this is Dr. Do again. On alphabetically symptoms, we have talked about the abdominal pain. Last time we talked about the aspiration and a little touch on the advanced care plans. Today I'm thinking about another topic which is very common in elderly patients. Elderly people maybe have been healthy or may have some pre-existing conditions. So the disease I'm going to talk about today is Alzheimer. Alzheimer, actually. It's age-related loss of memories. That's just the common word for explanation of Alzheimer disease. Okay, so basically it occurs in elderly, usually older than 60, 70, but sometimes there's a pre-symptoms, psychological changes, very subtle, and eventually increase the risk and develop Alzheimer. But nobody can tell at that stage unless later on develop the symptoms. What kind of major symptoms for Alzheimer disease? Of course, forgetful. Usually it forgetful for the recent memories, and the remote memory, however, may exist. May at early stage still have the remote memories. For example, what happened in the childhood or early adult or early years, and these are getting actually very clear. So this is a good sign. Probably is not quite good sign when your parents or yourself at around 50, 60 years old, you remember those old remote memories. It may indicating that the new memory, the recent memory may be getting lost, loss of recent memory later on. Okay, anyway, so the purpose for this video is to talk about what kind of symptoms you need to see the emergency, what kind of symptoms you need to call the physician, what kind of symptoms you can manage at home, even though the memory loss. Okay, let's start from the emergency situation. When people getting older, some of them maybe live alone, some of them maybe live with the families. The family member usually to notice the symptoms. The emergency situation, of course, is falling. Okay, elderly patient. You do not know whether or the patient himself or herself or the family member cannot confirm whether has memory loss or not, but that just the falling is the most serious condition, emergency visit for the elderly patient. So if you yourself or your parents fell at home, then you need to, regardless of what, take him or her to the emergency room. And the other is dehydration for elderly patient. You do not know whether memory is intact or not, but just forget things and forget drinking water and dehydrated, getting fuzzy, frustrated, and even sometimes altered mental status. That's also quite common, especially in summer and in the hot southern area when the temperature is very high. So this is another very serious condition for elderly patient. May have Alzheimer, which is not diagnosed. The third one is for elderly patient, serious condition or need to see physician or go to the emergency room visit. It's the UTI, which is urinary tract infection. It's subtle. The patient may have Alzheimer, may don't have it, may not have it, but and especially female patient. The urinary tract infection is quite common in elderly. The symptoms are very subtle, just low fever and plus dehydration. So this condition imposed the higher risk for both, for the dehydration and also the urinary tract infection. So the taking home message for if you have elderly parents at home or yourself is kind of older than 65 years old, watch for this kind of problem. First of all, to make sure you're not falling and walking slow, steady, and make sure you have cane or walker available if your legs are weak and if your gait very stable, not very stable. And also make sure you rehydrate. Probably you have high blood pressure, your doctor told you do not drink a lot of fluid. That's good, that's right, but at the same time you need to monitor. Do not get dehydrated, especially in the summer. Monitor your fluid intake and the sweating and sensible, insensible loss of fluid. And the third one is, as I said, urine tract infection. It's very subtle, especially if you dehydrate, just increase the risk on these symptoms. So if, and the third one is the pneumonia. The pneumonia is kind of obvious. It's not like the dehydration, the urine tract infection, so subtle, very easily to be ignored. So that's the emergency situation. You need to see the physician. Call the physician office to schedule. If your family notice that you're forgetting things, you turn on the stove when you forgot. It's not just one time, repeatedly. It's one time, we do it all the time. We're busy on these things and then turn on the flame and came back and forgot about that. If once in a while, it is okay. But if you do it frequently, you impose the dangers to yourself, to the family, to the neighbors. So this is the alert sign. The family should call the physician office. Or if you notice you need to, usually you don't. For those patients who have the Alzheimer's disease, they do not recognize that they have lost memories. So that's the dangerous part. Okay, so the family will notice you drive around and get lost. Couldn't find the way home or couldn't find the way you meant to go and you used to know. This is another sign. Not one time again. One time, two times. It happens to everybody, even to younger people at 30s or 40s. But if you frequently do this, then this is also another very dangerous sign. Your family or yourself notice they should call the physician to schedule appointment. They will evaluate you whether you have or you don't have the Alzheimer's disease. Number 3 is your daily life qualities. Some of the Alzheimer's disease start from the changing personality. Very easy to get frustrated, lost temper, shouting for no reason, or shy, withdrawal. These kind of symptoms when you're getting older than 70 or 65, 70 years old, you're changing personality. This might be a sign indicating you have Alzheimer's disease. So these are the what I can think for the summary, what kind of symptoms, what kind of problem relating to the memory loss. You need to call the emergency and you need to call the physician to schedule. And what in terms of elderly patient, I do not recommend any management at home. See your physician, either emergency or make an appointment. So this is my video for this time, and thank you for tuning in, and I'll